Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Mountain Moving Faith. This is my latest book. And if you want to learn how you can move mountains, life has many mountains. While this journey, you will encounter mountains and you wonder, how can I move mountains? This is a book to read. And it took me time to research, to pray, and to wait on God and look at the scriptures and what Jesus talked about moving mountains. And this book is quite a story, it's quite an inspiration. It is quite something that will change your life. So order your copy today. We can send it to you wherever you are in this country. We will be able to send this book to you on Mountain Moving Faith. Call that number or send a message and our team will be able to ship it to you wherever you are. There's a book to read. You can also buy for your friend, for a family as a gift. And I have no doubt they will thank you and that they will be always thankful for what you have done for them. So God bless you as you read this book, Mountain Moving Faith.
50% of patients coming in hospitals with pain complaints are struggling with lower back pain. According to the World Health Organization, lower back pain is the leading cause of disability. Are you struggling with low back pain? Are you looking for answers? Are you trying to avoid disability? Then this is a very interesting conversation. Welcome to the Healthy You, your favorite health program on Faith Today television. My name is Enock Kitondekijja, a medical clinician and your host. Allow me to start by recognizing JCK Hospital, the official sponsors of this program. You can find them in Roysambu along Lumumba Drive. They are also in Juja Farm. Those of you in Muranga County, you can find us in Mariaini. It's a blessing. Today's topic is lower back pain. How do we fix this? And the argument is, what is the right path to pain relief? We've seen people using painkillers. Is that the right way to go? We want to hear from the physiotherapists. What do they have to say about this? And to help us unpack this interesting topic is a seasoned physiotherapist from JCK Hospital. But before I invite him, I am aware we have people who are following us on social media. We celebrate you people and we encourage you to subscribe. Please like, comment. If you have any question, feel free to send in using the number on your screen. We are talking about lower back pain. The earlier you bring in your question, the better. We have an expert in the building today. Back to my guest, Mr. John. You are welcome to Faith Today television.
Thank you very much. Yes.
Would you kindly introduce yourself fully to the viewers?
Yes. Okay, my name is John Njoroge. I'm a physiotherapist and I work with JCK Hospital and many other, but I'm also privileged to be here as we discuss this issue of lower back pain, and I believe in lifetime, almost 80% of the population, you must experience the low back pain, and it depends on so many things.
Wow.
But we are here with you. Let us share and also enlighten them. They need to take care of themselves so that they don't get to wheelchair, they don't end up having the low back pain whereby they are not able even to do their work.
Thank you so much.
Yes.
This is Dr. John here with us.
Yes.
We are really excited to have you.
Thank you.
And you're talking about a very interesting statistic.
Yes.
80%.
Yes.
It's really a huge one.
Yes.
And for our viewers, this is a conversation that you don't want to miss.
Yes.
If the greatest percentage of us have to go through lower back pain,
Yes.
you want to know how to prevent it.
Yes.
You also want to know how to deal with it before it becomes a disability.
Yes.
And we have an expert in the building.
Yes.
How was your week before we even get into this topic? How was your week? How was it starting?
My week is good.
Okay.
I can't complain. I can say today is Tuesday, so we have more energy for the week because it's on a Monday, but it's fine and we are ready to work and also to help the patient.
Wow.
Yes.
I like the fact that you guys are determined, you are programmed to help patients.
Yes.
And of course that is why we are here, to help give people solutions, and then so we can get better.
Yes.
As we kick this off, Dr. Ali, we also want to understand the causes of, lower back pain. We really want to get an overview of what is it all about for the viewer out there.
Okay, before we go, what is the cause of the lower back pain? Let us also first of all know what is the structures when we say the lower back pain.
Okay.
And first of all is to have the overview of the spinal cord of a human being. And this is a good example because we have the cervical, that is from the neck downward up to, we have the cervical region, then we have the thoracic region, then we have the lumbar region, then we have the sacral region. So when we say the lower back pain, we say from the thoracic. Thoracic is where thoracic cavity, the thoracic region is where all most of the internal organs, the sensitive, the heart and all, they are caved there in the thoracic. But below the thoracic, that's where you start saying that the lower back pain, that is the lumbar and the sacral. And and sacral. And the pain can be within the lumbar, it can go to the sacral, it can go to the buttock. That's why you say the gluteal muscles. That's where we define the lower back pain. And the lower back pain, we define it in a way that there is acute and there is subacute and there is chronic. When you say acute, we say this is a pain which you have experienced maybe when you are standing, then you strain your muscle. When you are sitting, you strain your muscle. When you are lifting something, you strain your muscle. You can strain your muscle, you can strain your tendon, or you can strain your ligaments. Those are the three critical things that make you feel the back pain. But when it exceeds after 72 hours, then we say that this is a chronic pain now. So, and when you are treating the chronic pain, there are two things. One, most of these patients, they come as outpatient patients. So they pass through the triage, and then they are seen either by a clinician or a medical officer who will see the patient. Then maybe you can now advocate for some painkillers, maybe an injection or a painkiller, so that you relieve the pain. But after that patient, you can now book for a physiotherapy or orthopedic clinic, because you see now, as we don't say we believe on painkillers, but we believe even if what is the cause of the pain, that is what we focus on. What is the cause of the pain, so that because we don't advocate for a patient to live on medications at painkillers from Monday to Friday, years and years. As we advocate that yes, you take the painkillers, but what is the cause of this back pain? So we identify, is it a muscle? Is it an issue with the nerve impingement? Is it the issue of infection or any other things? So that when we realize that, we are able to help the patient. And there are so many causes. One of the causes which can bring the lower back pain, one is arthritis.
Arthritis.
Arthritis. And arthritis are different types. There is osteoarthritis. Osteoarthritis is where is the tear and wear of the bones.
Yeah.
It can cause lower back pain. There is also rheumatoid arthritis. This is an autoimmune disease whereby it affects all the joint of the of the body. So, being that the lower back pain is also have the bone, you can also get back pain because of the rheumatoid arthritis. Another thing which can cause lower back pain is the issue with the disc, and this is very common nowadays because of the way we live. That is, right now we are working for so many hours. We are lifting things in an unproportional way. So you find yourself, you got the issue with the disc. And when you say about the disc, they're different. What are we talking about the disc? This is the disc that we are saying.
Okay.
This is the spinal cord of a human being. Of what we are saying. This is the cervical region.
Yeah.
This is the lumbar region.
Yeah.
This is the thoracic region. This is the lumbar, and this is the sacral. These are the pelvic now.
So meaning this thing,
yes,
as it's an illustration of me.
Yes, yes,
turning like this.
Yes, that is
when
true.
I turn like this.
Yes, this is the illustration, of course.
Okay.
Of course, yes. And this yellow thing here, this is the spinal cord.
Now this is the spinal cord.
Yes, it's part of the brain now. It extends up, downward, up to the lumbar, lower side. So when you say about the disc issue, this is the disc. It's between the vertebrae.
Between the bones.
Yes, this is the disc. Yeah. Now the importance of this disc is act as a circumsober.
Yeah, like a cushion.
Yes, like a cushion. Okay. That's the reason we are able to bend. You are up, you can do side, whereby some of the bones you can't do it. So that's the reason it's here. Yeah. So you can get a back pain when this disc is herniated. When we say the disc is herniated, there is some fluid which is help this bone and the disc to have the movement. So sometimes, yes, that fluid can peel out. That is why you say the disc herniated. You can get a disc prolapse, whereby the position of this disc is out of the place where it is, then it's out. Now affecting the nerves. These are the nerves now.
Okay, these are now the nerves that rest.
Yes, that go from the spinal cord. Okay. These are the nerves. So once it is sprint, it's come here, it's now impinged the nerves. Okay. To start feeling the pain. Okay. Another reason which can cause also the back pain, we also see you can also have an issue with some of the internal organs. You can have like a reproductive system. If you have a chronic UTIs, you can also experience back pain.
Chronic UTI, maybe?
Yes. This is yes, which I've stayed for a very long time without treatment. Okay. Also, even prostate cancer, we see it in men. When it's in the advanced stage, you start experiencing lower back pain.
Speaking of that, I hear now you're really giving us interesting information.
Yes.
Because most people thought, like you have talked about, heavy lifting, you talked about the bones.
Yes.
Most people thought that lower back pain is just mechanical, but now you're giving us a bigger understanding that it can also be caused by cancer. It could be a cancer, it could be, talked about a UTI, a chronic UTI.
Yes.
Okay.
Yes, that is the truth. Yeah, you see now the low back pain. That's the reason why once I say the patient is coming from the outpatient. Yeah. But if you give the medication, then you can book for a physio or for orthopedic clinic. Then those are the people now that you go. Then you underline. You see what is the issue with the patient. So what we start with is the just routine. We do a check X-ray. We do an X-ray. When do an X-ray, you see the structures of the spine. How is the vertebral disc, right? Yeah. If we are not satisfied, we will do an MRI. Yeah. MRI is better because it will show us how the nerves are. Are they impinged? How are the discs? Are they in position? How are the vertebral bones? Are they in position? That one is very clear. So that when you underwrite, if there is also another issue, that's what we are saying, like those cancers and what, through MRI, it will identify there is something which is metastasizing. If we are now also, the patient is on physio and also on the medication to say is still following the orthopedic, and the pain is still there, that's when we advance now to do other blood tests and what, so that you rule out there's no UTI, there's no those infection tests. You can also have the back pain because of the You have said about the disc, you have said about those infection, you have said about the disc, you can also have it, we call it tenosis, that is narrowing of the spinal cord. Because the way it has come all the way through down there, because of the things that we do, sometimes the vertebra can press the spinal cord.
I mean, speaking of the things that we do,
yes,
can you kindly help us understand what are those things that could narrow?
Yes, one of them is that we have said there is a big problem that you're having nowadays, and it's really affecting people who sit down for a very long time.
People who sit for a long time?
Yes.
That means you are talking about people in the offices?
Of course, of course. We are getting a lot of patients. Because what you do, when you sit down for 8 hours without movements, even if you are getting movements only 30 minutes or 1 hour, you press. This disc now, they are now used to a point whereby they underwork, you overwork them to a point now to get this, we are saying the disc herniation and protrusion of the disc. That is one thing. The way we lift things is also very important.
Heavy lifting?
Yes. You see people who work in mechanics, people who work in Kwasoko, those are the people that we are getting, the people who work in somewhere they are lifting heavy things with bad mechanism of lifting those things.
So is there a right way to lift things and a bad way?
When you are lifting heavy things, first of all, we are sitting down for a very long time. So I advocate for people who are sit down for a very long time. When you sit for 2 hours, take a break.
Take a break of how long?
Yes, like 10 minutes.
10 minutes.
Move around, then come back. Because you'll work there for 5 years, 10 years, but I'll tell you the truth, one day you'll regret. Because one of the things that we said from the beginning, that the lower back pain, when you get this, the disc herniation and disc prolapse and those issues, one of the things that you get is that those we have said is that one of the things that contribute to disability, because this disc will now press the spinal cord to a point your legs are not able even to function. Sometimes you can even get urine incontinence because the nerves are so pressed to a point you can't feel it. I've seen many patients who come to the clinic, they don't even know where they have the shoes. They can't feel them. They can't even feel their legs. Some even end up to wheelchair because of those issues. So we advocate when you sit down, after 2 hours, have a walk. The second thing, when you are lifting heavy things, don't lift them through when you are using your back. For example, if I want to lift this
this
metal, if I am using it when I'm standing and I'm not bending my knees, I'm using my back. That's the difference.
That one, you should repeat it for our viewers.
Yes. When I'm lifting this metal, if I don't bend my knee, I'm using my back.
Then you're affecting the back.
Yes, my lower back pain. If I want to lift these things and in a proper way, I have to bend my knees.
You have to bend them.
So that now when I'm now waking up, I'm not using the back. That is one of the greatest problems that we are having nowadays. And then you see now, when you are doing these things, you're doing when you are very active at the prime age. So you don't mind because you want to make a living.
You don't even feel the pain.
You don't feel the pain. You say you have the energy, you are still young. But I'll tell you the truth. After you reach certain years, doing the same thing with the bad posture, sitting down, that's when the things change.
Wow.
That's when the things changed. So you start realizing now the back is paining. You are not even able to have that the energy that you have. Then you have these issues that we are saying. And what happens is you don't know that another cause after we are saying that when you overwork those muscles of the back, they get now the muscle spasms. Now this muscle spasm also contribute a lot to the alignment of your back. So they start now even when those muscles, they protect themselves because of you are working them, they now make sure that even the structures of those discs and the vertebra, they are now displaced.
I think that is very interesting because when you talk about muscle spasms, they are simply like twitches. So just those small twitches can affect the disc?
Of course. You see now, one thing people don't understand is all the muscles attach to a bone.
All muscles
attached to the bone. That is one thing you should do. So the once this muscles is stretched, it's having those muscle spasm. It's coming from a bone which is in the spinal cord. So it is going to kind of like pushing now this disc and the vertebra to the right position.
Okay.
So now affecting the whole spine. So that is the issue. So all the bones, all these muscles which are attached to the bones, the impact is now that the structure, all the structures are surrounding to that muscle will be highly affected. Because there is a muscle which comes from the spine, go to the hip. There is a muscle, that is the case. So you find yourself having an issue with the low back pain. It's even affect your hip.
Wow, thank you so much. I feel this is a very interesting conversation.
Yes.
And John, you're really highlighting very key elements that most people really don't pay attention to.
Yes.
Because growing up, we thought people who suffer from low back pain are the aged people, the elderly people are aging.
Yes.
But you also have alluded to the fact that the problem today with the young people is they work for long hours.
Yes.
They don't get breaks, and that affects them.
Correct.
You've also helped us understand that lower back pain is not just the mechanical.
Of course.
Mechanical can affect, but there are also other non-specific.
Of course.
That means you guys are working well with the doctors and things like that.
Of course.
So when should people come to a physiotherapist?
Okay, you have just outlined, you have seen the patient has been diagnosed with a low back pain, you have done the x-ray, you have done the MRI, you have also ruled out what you have said, there's no infection, there's no any malignancy. That's when the patient...
Malignancy meaning any cancer?
Yes, there's no any cancer which is malignant. So that's when patient is now referred to a physiotherapy department.
Okay.
When the patient is able to come to a physiotherapy department, that's when you come and you do a very proper history of the patient. Then you do a very thorough investigation in terms of you see the patient, how is the patient working, how is the pain?
Yeah.
Because even some people how is the pain? What is the cause of the pain? What is the aggravating factor of this pain? Because sometimes you can be, when you sit down for a very long time, that's when you experience the pain. When you bend, that's when you experience the pain. When you walk, that's when you experience the pain. So when you do that, then you can have the proper plan of the patients.
Thank you so much.
Yes.
About that, doctor is helping us understand that these people, the physiotherapists, are here to help us understand the real cause of your pain. If you do not involve them in the picture, you are going to deal with a wrong thing for a long time. And before we conclude this, I have an interesting analogy. You know, I come from a background of the house of faith.
Okay.
And when you read the scriptures, we realize there's a man, a psalmist, David. He struggled with pain at some time, and this was specifically back pain. You know, when you read Psalms 38, it talks about how he was in too much pain. He felt like his health is going away. He only didn't give us the classification like you have done, acute, subacute, and chronic. So speaking of that, how do you manage based on the acute, subacute, and someone who is having a chronic pain? How do you approach that in terms of management before we take a short break?
Okay. So one thing you are saying, the acute pain is where you are experiencing a pain just one day or two, then you are good. What we do, there are things that we use. There is something we call the ice pack, and of course nowadays it's everywhere. You can even use it when you put some water in your fridge, deep freezer, it's become called ice packs. They are very good on acute pains, whereby you apply ice. The need of this ice to help in relieving the pain, because it interferes with the nerve endings. We are saying this pain, it's coming from a muscle or a disc or a vertebrae. But the reason you are feeling the pain, because all these structures, they are affecting the nerve. So once the nerve is affected, you feel the pain. So once you put this ice pack, to help now the affecting, interfering with the nerve endings, so reducing the pain.
That is for the acute.
The acute.
Then subacute?
Yes. Subacute, the same case. You use the ice, then you can be able to use some painkillers for that. But for now, the chronic pain, it's different now.
Chronic pain in how do you...
Yes, so we are saying you have experienced pain for the last more than 3 hours. More than 3 days. That's when you say this is now a chronic. Because even if you have been given a medication, because you are you have told, go relax, give yourself time, the pain is still there. Those are the most patients that we see in our clinic.
Okay.
So because the chronic pain now, this is a process now. Because you have to identify which are the muscles which are affecting the back now. Because mostly they will come with all those issues that you have said. So you will do something called soft tissue manipulation. You'll work on which are the muscles mostly affected. Yes. You work on them because you feel those spasms through your own hand. You know the good thing about physiotherapy, as we don't use medication to treat people.
Wow.
It's only our own hands. So you'll come there, I'll identify this is the issues, which muscles is being affected. I'll work on it until it's become relieved. Then there are some of the things that we use to relieve the pain. We use a hot pack. Hot pack, this is something that is a pack that we use through warm water, that is moist water.
Okay.
When you put it to a muscle to help now to relieve the pain and also help now the structures around where they affected these muscles, the blood vessels kind of dilate, they become more bigger. Okay. Now improving the circulation of them, because this muscle spasm also affect even the circulation of the blood flow.
Well, the spasms
yes.
go a long way to not only create pain,
yes.
but also interfere with blood flow.
Of course.
And that is not good.
Yes. They interfere actually with the blood flow. So when you work with this muscle, then you put this hot pack to help with the blood flow.
Okay.
Then for relieving the pain. Then after we use the hot pack now, you can also now start showing the patient the need of back exercise. Okay. Exercises are very important when we are treating patients with low back pain. And there are different type of exercise.
Different type of exercises. We are going to take a short break. Yes. And when we return, Mr. John here is going to help us understand what can we do. He has highlighted exercises, but what are those kinds of exercises? I know he has a plan for us on how we can truly manage this chronic back pain like he has highlighted. And interestingly speaking, this gentleman does not use any medication. Remember, the argument today is painkillers or physiotherapy. Most of you have been running to painkillers to treat things that you even don't know, treat problems that are not there, and you end up suffering for a long time. If you have any question about this conversation, there's that number on your screen. Please utilize it. Send the questions right now, and we are going to give you justice. The earlier you do, the better. He has also talked about the occurrence of the likelihood of all of us suffering from back pain, and that is about 80%. That's a very huge percentage. So you'd want to understand, how do we prevent lower back pain? He has talked about it affecting people in the workspaces. WHO has highlighted to us that it is the leading cause of disability. You want to avoid disability at all costs. Until we meet, just a few minutes. Don't change the dial. God bless you.
Okay, asante. Nilikisajili kitabu ambacho kinaitwa 7 Keys to Success, ama kuna kanuni funguo 7 if you like it, ambazo zitakuletea ushindi na kufaulu maishani. Wote, wewe na mimi, tunataka kufaulu, lakini pia kuna njia ya kufaulu. Ukisoma hiki kitabu ambacho nilikiandika kwa kufanya utafiti, kwa maombi mengi, kuangalia neno la Mungu, I have no doubt ya kwamba hiki kitabu kitabadilisha maisha yako. Nilikuwa naongea na mchungaji rafiki yangu, akaniambia nilisoma hicho kitabu, sasa ninafundisha watu wangu kupitia ujuzi, maarifa, hekima ambayo nilipata kwa hiki kitabu. Kwa hivyo unaweza pia nunulia watu wengine, na akaniambia alinunulia hata viongozi wake, na wamekuwa wakisoma, wakaweka kwa library yao, wanasoma hiki kitabu. Sina mashaka, nina uhakika itabadilisha maisha yako na utabarikiwa. Tuma message ama upige simu kwa hiyo namba, na naweza kuwasiliana na wewe, na utapata hiki kitabu, utatumiwa, usome na ubariki pia watu wengine. Asante. Mungu akubariki unaposoma 7 Keys to success, and you will succeed. Thank you.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV. Okay, welcome once again to the second part of our discussion. And this part we are really focusing on the management strategy of lower back pain. We have an expert in the building. He has highlighted some of the approaches we can consider while dealing with lower back pain. He does not work with medication. I know most of you have been running with medication, but he's giving us a different approach to this. And as we carry on, I see questions coming in. And before we continue with where I will read just one question. This is Nelly. Nelly says, I'm Nelly, enjoying the show. Are there things I can do at home to reduce my back pain? This is Nelly, who is already struggling with back pain. He's asking for how can they deal with their back pain. I think that is something that you're also going to help us understand, because at what point, before you answer her, should people come to a physiotherapist? At what level? Because people are so much accustomed to the quick fixes. You've had people using painkillers.
Of course, you are right. We advocate patient, even our clients. One thing that that can help you to reduce the back pain is, you know, the problem in nowadays is our lifestyle. Has really changed. Nowadays, people don't walk. Nowadays, people don't exercise. We sit down for a long time. So one of the things that should help you to never experience those low back pain, even if you're having back problem, you can be solved even before even you go for physiotherapy. Can you correct your posture?
Correct your posture?
Yes, the way you sit.
Speaking of posture,
yes.
So how should I sit? For example, right now,
you see me the way I'm sitting.
I am in the, I'm at work.
Yes.
Doing my work. I'm on a desk. How should I sit?
You see the way I'm sitting? That is. You should always support your back.
Come and show the viewers. They would want to see. How should I sit?
Okay. The best correct posture. Yes. You should always support your back.
I should support my back.
Yes, that way. Leaning on front, on side this way, the other side. Those are the big causes that bring those, we are saying, the disc issues.
The disc issues.
The vertebral issues is because of the back posture. Because you sit down for a very long time, bending on one side, you affect the one side of the spine. You bend on the other side, the same case. Nowadays, you also have this tendency of the phone. All of us are in social media, which is not bad. But when you put your phone this way, then like you start bending heavy. I have young girls and young boys, actually even in high school, even in college, who are coming with spine issues because of using phone for a very long time. Yes,
for a long time.
Yes, with a bad posture. That is one thing. Because one thing, if you're using a phone, make sure that it's within your eye contact, this way.
This level?
Yes.
I should not be doing like this?
No.
Okay.
Imagine doing this for 5 hours every day. What do you expect? You strain these muscles.
You are straining muscles.
And when you strain these muscles, what they do, when you strain them, they protect themselves. You get the muscle spasm. When you get this muscle spasm, we say a body is attached to a bone. A muscle is attached to a bone. So they
contract.
They contract. They now affect the alignment of your spine.
The
Now it's
spine.
yes, they now affect the alignment of your spine.
Okay.
They make the disc to not to be in the same position.
Okay.
They affect the nerve where the nerve passes. They affect even the spinal cord. You end up having the issues. That is one thing. Correct your posture.
Correct. You
Yeah.
begin by correcting the
your
posture.
Sitting down properly, using your phone rightly, the right way.
What about those who are on a computer? How is it?
Yes, that's the same case I'm coming. If you're in the workplaces and you know you work and you sit down for more than 5 hours, can you tell your employer to give you the right seats?
The right seats.
Yes, that is the
Meaning
truth.
we don't just have to
Because
sit on any seat.
you'll work there for 20 years. But when you go to wheelchair, your employer will not be there. That is the truth. And I even tell people that even if because we advocate for those orthopedic seats,
Yeah.
and they are there for the people who sit for a very long time. Comfortable seat, not a plastic ama hizi za chuma. Comfortable seats which will help you so that you don't have issues in future.
Speaking of that,
Yes.
I think this is a very interesting conversation, our viewers.
Yes.
Be intentional.
Yes.
Even as you go to a furniture house,
Yes.
you don't just buy any kind of chair
Correct.
or seat. There are certain seats that are going to preserve your back. For those of you who have just joined us, this program is sponsored by JCK Hospital. This gentleman here is from Roysambu. I know most of you are sending in your questions, but we may not answer all of them. If you really want quality time, you have to engage these people. Daktari,
Yes.
you're also marketing the furniture houses right now who are doing furniture, but also helping our clients understand that
Yes.
you don't just sit on anything. Please carry
Because
on.
once you get the lower back pain, that's when you realize what you are telling me.
Okay.
You have said one is correct, yeah?
Posture.
Posture, that is one thing.
Get the right
There are
seats.
people who even drive for a very long time. The
Drivers. Yes.
I've encountered so many of them who are my patients.
Okay.
People drive for 10 hours
Yeah.
without even sleeping, without even standing. They are in the same posture for 8 or 10 hours.
10 hours.
That is, actually nowadays we say, sitting is the new smoking. You know the way people used to smoke long time ago? This is now the problem that we are experiencing right now. That's the reason you see, previously, you could see low back pain will happen to 70, 80 years old patients.
Yes.
That's when you come, you see a patient coming, they are saying they experience back pain. Nowadays, we are treating within 20 years, even 15 years.
Are you sure?
Yes.
You know, we thought this is a problem. Of
No. People are coming from kids who are in high school. They are coming to our clinics.
Back problem.
Back problem, even primary school.
Wow.
Even so, you even wonder because of the bad posture. Because even right now they are in holiday.
Okay.
Most of them, they are already in that seat. They stay there for 5 hours, 6 hours, watching the movie with the same posture. They are not even changing.
So this is
They're only changing. There's when they go to eat and then come back.
maybe even to pick the remote. That's when they change.
Correct.
So this is a call to action for our
Yes.
parents. Looking at the future, we are trying to avoid disability.
Yes.
It has to come from you as a parent to
Yes.
begin nurturing your kids when they're still young.
Yes.
How should they sit? What should they sit on? How long should they be on the screen?
Yes,
You
yes,
know,
yes.
how long should they be on the social media?
Correct.
Because, you know, when
You
you're
limit
still young,
them, yes.
you really don't care so much. Some small pain you ignore. But, you know, speaking of that pain that we ignore,
Yes.
what are some of the complications? I'm sure if we do not talk about
Yes,
this,
yes,
my
yes, sir.
viewer will
Yes,
strangle
yes,
me.
Yes.
What are some of those complications in case we don't deal with lower back pain effectively?
Let me tell you, so many complications. If we don't deal with the lower back pain properly, this we say you can. One thing we said you can go to a wheelchair. Wheelchair you can almost even reach to a wheelchair because of so many reasons. Because this we said these structures, one they impinge the spinal cord, not the nerve, the spinal cord. You now start having issues with your legs.
Okay.
Yes, they become weak.
Okay.
Sometimes you are not even able. Then you get first of all they become weak.
Okay.
So another thing, there are people who also experience the urine incontinence.
People who cannot stop you.
Yeah, no, they cannot even feel.
You cannot even
You
feel.
cannot feel they want to go to short call or long call.
I think that is serious now.
Yes.
I mean, we
yes,
are here
yes.
seated.
Once the spinal
and then-
cord is fully, it's now fully impinged, you can't feel them. And
This one?
yes, once it's impinged here, you know now, spinal cord is the one that controls all that.
Okay.
So once it is impinged from the lumbar region now, you know, start to experience that you're not even able to feel your legs.
You don't feel your legs anymore.
When you want to go to a short corner marongo, you can't feel it.
Wow, now
that's
that is
the
worse.
worst case.
That is terrible.
Then end up now going to a wheelchair. Most of them end up going to a wheelchair.
So most of the people we see in wheelchairs,
yes,
it's because
yes.
of,
yeah,
you know,
most
they
if
didn't handle.
the issue came because of the other things which can make you to go in a wheelchair, the other diseases. But if the issue was a low back pain, and we have said that we have gone all through things, MRI has showed that there's a severe spinal cord pressed, either by a disc or a vertebral bone or what, that is the issue. Because also it can happen if you have a growth. Sometimes there is those growth, it can be benign, just a small growth that it has impinged the spinal cord. But when you realize the patient is now cannot even feel when she's going for a short call or he's going for a long call, he is not even able to feel. Some of them come even, they don't even know they don't have shoes. So that when you refer the patient immediately to orthopedic clinic, orthopedic surgeon for review, and most of them end up going for surgery. And
that is very insightful, Doctor. Yes. Speaking of that, you know, people are so much accustomed to painkillers. Why are physiotherapists advocating for physiotherapy other than painkillers?
You know, as we believe, you see now the problem with long use of painkillers is the implications.
What are the implications?
When you take those painkillers for a very long time, they affect your internal organs.
They affect the internal organs?
Yes, and liver, because they're the one who are processing this. And the key function of a liver one is to filter anything that it is entering your body.
Detoxify.
Yes, that is one thing. The same case to the kidney.
To the kidney.
Yes. Yeah. So when you take these painkillers for 10 years, what do you think you are doing to your kidney and your liver?
You are damaging it.
Correct.
I hear some people even have stomach pains.
Yes, and that's the reason we don't advocate for painkillers for a very long time. Even if you take those painkillers, we only advocate when the pain is too much. Then continue with the physiotherapy or come for physiotherapy clinic. And I have seen a lot of patients who come even with a wheelchair and they end up even learning, because as long as you do the right thing, you work on those muscles, then you advocate the patient, then you show those the exercise of the spine and the back, then you advocate the patient on the correct posture, then you tell the patient, if some patient is an obese patient, it also can cause low back pain, then you tell the patient to start now changing their lifestyle. Okay. Make sure that every day you have like 30 minutes walk. 30 minutes walk every day? Every day. It will help you. It will help you, because even if you strain those back muscles, once you are walking now, you are relieving them. Once you are going for a gym for aerobic exercises, you are now relieving them. Because that is the problem that you're having, that you wake up at the morning, 8, you are into work, you leave at 5, you go in the house, you sit, you sleep. Wow. That is very insightful. Yes. Doctor. But when you change all this, it will help you a lot. That is one thing. And I like the fact that you have helped us gain more hope. Yes. That even if I came to you in a wheelchair, you can fix me so that I leave the wheelchair. Yes, yes, yes. That is Dr. for you. Yes. And questions are really coming in. Yes, yes. Let me take another one. If I don't, someone will strangle me. Okay. I will take mostly those who give us their name, if you don't mind, your first name and where you are watching from. It will help us also follow up from you. The first one was Ken in Utawala. He says, "Morning, Doc. At what point do you recommend surgery on someone's back?" Are there people even who go in for surgery because of low back pain? Yeah. What we said, if patient comes in the clinic and you realize, first of all, what you have said, those one alarming thing, they can't feel their legs. You can't feel their legs. They are in a great pain. Even if we give them those painkillers, be it through the oral or through injection, they can't even sleep. They can't sleep. They can't even do anything. There is a lot of pain. Those are the patients that we advocate. The best thing should be the surgery.
Surgery. So
yes, another thing is what we said, the urine incontinence. If you realize the patient cannot be able to know
to stop and to know.
Yes, for a long call or a short call, that is automatically. You advocate patient to see an orthopedic surgeon and maybe probably for surgery.
For surgery.
Yeah.
Thank you so much. This is Janet from Thika. Says, my mom always complains about terrible back pain. She has refused to go to hospital. What is your advice? I'm sure she's watching. Wow, Janet has connected the parent. That's good.
You see, now, the problem, there is this myth which goes around, that once you are sent to a physiotherapy session, unaendanga kuchoma. That's an analogy. Unaenda kuchomwa na stima. And it's mostly in old people.
They fear that you're going to burn them.
Yes. Once you are put those vitu za kuchomwa, they will actually get worse.
Okay.
There is that ideology. There is that myth. But I will actually tell them that is this that we use nowadays. I use my own hands. I use hot pack. Even if I have to use some few machines like the one we use for stimulating the nerves, if the nerve is free, is impeached sana, we use the machine that we use to stimulate the nerve. Or if you have issue with the nerves, nothing else. Now these things, they don't harm anyone. Even us, when we have those back problems, sometimes we experience them, we use them. So I know those are the things that actually make some of the patients, especially our parents, that is, they have a problem with that. But what they do, instead of going to the clinic or coming for physiotherapy, they end up now, they are now used to medication.
I get that. It's
yes,
like now food.
It's their food.
Oh my God! Now that's
anytime wanasikia anything ka pain, bring ile dawa yangu. Which at the end of the day, when they take for 5 years, 10 years, you now start experiencing them. They have issues with the kidney, with the liver, and the other issues. Wow. So we don't have anything that can harm a patient. Actually, we are there to help them.
Help them.
Yes.
So Janet, in other words, Mr. John here is telling you, when you come to the hospital, ask for a physiotherapist.
Yes.
If your mother is scared, tell them when they go, I want to see a physiotherapist, because this is not an emergency.
Yes.
So they will direct you to these people and make sure you express yourself. What do you want? What don't you want? These doctors are also human.
Yes.
Speaking of that, what are some of the challenges that are you people facing? Because I've hosted a number of them, and these doctors tell us about the challenges they face. So for you in your domain, are there any challenges?
There are so many challenges. One, in terms of health setup in the country, because for you to get a physiotherapy, you can't get them in a dispensary. Most time you get them from a level 4 hospital and above. Like
JCK hospital?
Yes. Okay. That is a great problem that you have, because most of the people in our rural areas, they don't get those physiotherapists.
They don't have
Even
access.
if they get those physiotherapists, they have to go a very long journey to get a physiotherapist. So that's the reason why they end up going to those medication. That is one thing I can see. Another thing is what you are saying is about how, you see now the moment it's become a low back pain, it's chronic. It's not one session. We can do like 10 sessions. We do 5 sessions, we review the patient. We do another 5 sessions, we review the patient. Are you helping the patient? Is it patient improving?
You see, you're giving me so much courage.
Yes.
You have sessions.
Yes.
Like someone, when they come, you don't just, deal with them, manipulate or whatever. You have sessions.
Yes.
Our viewer, these people have sessions they are going to take you through so that they deal with this pain without any pain medication. Doctor, this is very interesting. Someone here is asking a very interesting question that you should handle. He's saying, I am Steve, and I have a friend who works in a TV studio, and he keeps sleeping on the hard floor whenever he can. He complains of back pain, and that the hard floor helps. You get? He's fixed. The hard flow is helping him.
Yes.
What can you advise?
That's actually the worst thing, because the hard floor, it's even the worst because you even harm more.
Are you serious?
Yes. So that's what we have said. If you sit down for a long time, look for a comfortable seat. If you have started experiencing low back pain, look for orthopedic seat.
Look for an orthopedic seat.
Yes, that is the truth.
So, Steve,
Otherwise, those hard surface, you'll do it when you are young, but it's a short time. You start experiencing the complication will just follow you.
what about us who have the back pain, and then these people who sell mattresses tell us when you buy a flat mattress, hard mattress, then you will not have any back pain.
Actually,
what do you have to say about that?
Yes, that is one I can agree. You should always have the right mattress, and the right mattress is
even you have to have a right mattress.
Yes, actually, also the orthopedic mattress. If you start experiencing back problem, look for the orthopedic mattress. Also, if you can't afford because they're a bit expensive, look for a soft mattress, but it's not the one which is curved. Ukilala ikona curves. No,
it's like
that is the problem that we are having, because even if when you sleep, it's like kama usiku, it's like also you are working and you are sleeping.
People work in the night.
Yes, that is the truth. People work at the night, but the issue is now,
imagine
the
someone who's dreaming,
now, you can imagine now.
Imagine someone who's dreaming, they are pursuing them, and then there's that kind of...
Yes, so you should have, your mattress should be at least not that slim one, a comfortable one, which is not even having those curves.
Yes.
So that you can have a nice sleep and also correct your posture.
So you are trying to advocate for new mattresses.
Yes,
now.
nice mattress for your health.
Okay.
Because you don't do that.
You see, our bishop on Sunday the other day,
yes,
he was encouraging people to change, change their mindset. If you have been using something for a long time, it's good for you to now change, bring in new stuff.
Yes.
And the mattress is one of them.
That is the truth.
Changing your seats is one of them.
Actually, me, I tell people, because you know now, the bed is the where we spend almost 7, 8 hours every night.
Yes, yes.
So you should have a nice, comfortable mattress, so that those 7 or 8 hours that we sleep, we are able to sleep comfortably, so that we even have the energy to work.
The energy to work.
Yes. Because when you have bad mattress, you actually wake up in the morning, instead of feeling that you have been relieved that you are
going to work.
No, it's even the different. You start now experiencing the pain, so you cannot even perform in.
Okay.
During the day. So I work. Please have the night mattress.
Yeah.
Then then keep on changing your mattress. If you see your mattress is now becoming too slim, change your mattress, buy another one. If you can't afford those, you are saying the spring and the orthopedic mattresses.
I think we are having a great time with you, Daktari.
Yes.
I also want you to help us understand, because the statistics show that 50% of people who have experienced lower back pain in the acute phase, even after treatment, it recurs within 1 year.
Of course.
So what is a sustainable management plan for
By the way, once you experience back pain, even once in lifetime, you should know now you are a candidate of getting a chronic back pain. So what we advocate people, what we are saying is, if you correct your posture, then check the way you are saying, like mattress, the seat that you sit, then change your lifestyle. If you are mtu wa ofisi, somebody who drive all the time, change your lifestyle. Have your time, at least even if it is within the day, within the day you can't find time. At least on a weekend, look for one day, have a walk. And train, have a walk. Maybe Saturday or Sunday, have a walk. Like 1 hour walk, and also train your kid the same. You can also do, there are so many activities we can do. You can join a team. You can be a volleyballer, you can be a footballer, you can be a basketballer. There are so many games in this country. So join one. And if you can see, the people who have lived have aged gracefully without issues. Even if you go do your own statistics, there are people who have routine program of exercises. People who are intentional about their health. That is the truth. People who exercise. You see, on Sunday the other day, Bishop was helping us understand. In the scriptures, it says, little exercise profiteth a little. So that little, you need it. Daktari, we are winding this up, and in just one
I mean it,
Yes.
or less.
Yes.
Kindly just say a word to our viewers. Yeah,
First of
your takeaway.
all, I'll thank you for me inviting me here,
Yeah.
and also thank the viewers for the great opportunity, and also they have also learned. But what I will tell you, your health is very important. And I have my one policy that I keep saying, yeah? You don't deserve a pain. You don't deserve it. So if you feel that you're having those back issues, be it neck, be it what, please come for a physiotherapy clinic. We are going to sort you. Love yourself. Change your posture. Walk. Exercise. All these things will be sorted. Then check your diet. It's
your
also
diet.
very important.
Well, thank you so much.
Yes.
He says, love yourself, which is
Yes.
very important.
Yes.
Thank you so much, Mr. John.
Yes.
You have really given us quality stuff today.
Yes.
And for our viewers, we learned that the lower back pain you are experiencing, do not ignore it. Do not rely on the pain medication that you have been taking for a long time. It's important that you come for a medical checkup, because these people help you understand the real cause of your problem, and that is what you want. Deal with it, and you're a free person. Thank you so much. This is Faith Today Television. My name is Enock Kitondekijja. And for those of you who are following us on social media, there are those who are watching this in the hospitals. We are always praying for you, and we believe that even as you're on medication, we pray that your healing comes forth speedily. If you believe this, say amen. You can as well also type amen in the comment section. But until we meet next time, stay proactive, stay informed, stay healthy, pay attention to your back, because it matters.